Hi, my name is Dr. Jane Mate. I'm a consultant pediatrician at Shah Children's Hospital. The majority of the cases we get in the pediatric casualty, the accident and emergency department, a lot of cases have to do with accidents in regards to children. So the different cases that we see, you'll have children who've come in because of a fall. Either they've fallen down the stairs, they've fallen out of a balcony, out of a window. We have a lot of children coming in with injuries because of burns. This is from liquids, from power outlets, electrocution. We also have children who come in with choking hazards or foreign objects in their ears. The other concern we get is ingestion of harmful substances, whether it's household chemicals, overdose or accidental ingestion of medication in the house. So these are some of the common things that we see in our pediatric outpatient. They are preventable, and there are very easy steps that we can take to prevent these accidents and to prevent unnecessary injury and possible complications, just by taking these simple steps and possibly educating the caregivers on how to prevent these accidents. So child safety at home has very many different facets. You have child safety in terms of falls, which tends to be the most common one. So you'll find that most households, whether you're in a one-story building or whether you're living in an apartment, a lot of children have the risk of falling down the stairs or falling down from an open space, whether it's a balcony, an unsecured balcony, falling off the window, or simply just running and encountering a fall. The other one that we are seeing, which is coming out quite commonly, is falling off the bed, whether it's the bunk beds, the double-decker beds. Is quite common, especially for the younger children. So falls is a very big one of the issues that we'd like to tackle in terms of safety at home. The second one that we encounter quite a lot is burns. I've talked about different kinds of burns because of hot fluids. So you find that somebody has left an unattended cup of coffee or tea on the edge of the table, or for example, the table has table mat, and you have a crawling child who pulled on the mat, and then you encounter a burn from whatever liquid is left on the table mat. We also have sufuria handles and pans, which are left dangling off the edge. Say somebody's cooking in the kitchen, and you lift the handle off the edge, and the child is able to reach the handle, and the fluid comes pouring down on them. We have cords from kettles, irons, which are just left hanging, and they're very easy for the child to pull. One, they will encounter trauma from either the object falling on them, or if it's a kettle with hot water, then of course they're going to encounter burns from the liquids. So those two are very common. We also have outlets or sockets that are left unsecured. So you have a child putting pencils and sharp objects into the electrical outlets, and this can lead to electrocution injuries. Then, of course, we talked about ingestion of chemical agents, which are quite common in our households. Most of us will have bleach, disinfectant, toilet cleaners, and, of course, medication. So you find if these are not properly stored, if they're not kept under lock and key or in a very high shelf that the children cannot reach, then the children are able to access these chemical agents, and they're very curious. So, of course, they're going to want to try and find out what does it taste like, what does it smell like. So it can be injuries because of ingestion of these chemical agents, just having these chemical agents come into contact with the skin. And, of course, wrong ingestion of medication, whether it's medication for the adults in the house or even the children's medication. And especially for children's medication, we know a lot of it is very sweet, very palatable. So you might find a child will overdose on their own medication simply because it's easy for them to access and ingest these substances.